oblique, you do need to make sure your marker is on the correct side relative to the anatomy. Okay? I don't want any of you guys getting yelled at. It's already bad enough in the OR. You don't need it. You don't need it as a.
I hate the OR. I hate it.
All right. And then if we're gonna do the right oblique, you know, Mike, I'm gonna have you match my feet this way, and you're gonna turn. So this one you have to be careful. A lot of patients move their shoulders forward because they know they're gonna be turning their head to the side. So I'm gonna have to move Mike's shoulders back, and now you turn your head. You always have to make sure they're at the 45. So usually when you're doing the other side, patients have an idea of what you want them to do, so they do a little too good of a job, is what I tell them. Like, oh, you're so helpful, but I'm gonna have to change you a little bit. I'm gonna bring you forward towards me, okay? And it's just because they're anticipating the head turn and to be more flat, so you might have to bring their shoulders back to make them at that 45-degree oblique, okay? All right. So that's our posterior obliques. All right, Mike, you can just put your back against the board. Now we're gonna do AP. So the AP is the one that's at 40, okay? Again, C4, you can close your eyes if you need to. And then I open up to right below the nasal bone. I'm going to move you just a little bit away from me, line you up a little bit better. Perfect. Bring this down.
And then it's a 15 to 20 degree angle, right?
Yes.
What's the like variance? Is it just like personal preference or just based on their?
It depends on the patient.
Okay. Just
Yeah.
how big they are or something.
Also the curvature of their neck.
Mm-hmm.
That would be really what it is. So for men, it would basically be at the Adam's apple, but I know for women, we don't really have it, so about C4. Another thing is I would have them raise their chin slightly, but not too much, because if they raise their chin too much, now you have the base of the skull in the back obstructing the C-spine, okay? And then I always have my patients lean against the board so that they're not swaying all over the place, okay? And that would be your AP axial C-spine, okay?
Where are you saying the bottom of it is?
So as long as you're about at C4, you just open it up until you see the top is at the base of the nose,
Okay.
and then the bottom, you don't really have to focus on that.
Okay.
Yeah.
Do we have to worry about the chin also being slightly up when we do the obliques?
For the mandibles to be like leveled out.
Yeah, you don't want them to bring their chin down, but usually when you have them turn and then they turn their head, naturally they lift their head. They don't, you know, that would be kind of a more difficult position to bring their chin down than it is to turn their head and raise their head out of the way. So I personally haven't really come across it for obliques for that reason, but that is good to be aware of. Okay. All right. When you guys are ready, I'm going to move on to the soft tissue AP. You guys ready? Okay. So for soft tissue AP, it's going to be straight on. The reason why we don't angle for this one is because if there's a foreign body, you angle, it's going to make that foreign body look like it's somewhere where it's not. So you want to go straight on so that the doctor has exactly 2 different 90-degree pictures so he can pinpoint exactly where that battery or whatever it is that the child swallowed. For this one, you are going to include the nose. We do need to include the entire nose for this picture, okay? And that's so that the doctor can see if there's anything in that airway. And that's the difference between your C-spine and then your soft tissue neck. Okay. I'm gonna move on to odontoid. I always, oh, what,
Sorry, so just essentially the same as the AP, just different collimation of it, just to include the nose.
and what else?
Technique.
No? Oh, that too,
No,
but
no
okay, so
angle.
what else?
No angle.
Right,
No
no
angle,
angle.
yeah.
You got it. When I go onto the odontoid, I like to close my light field so I don't blind my patient. So I make a nice little square, okay?
That's why I open my mouth.
Not yet. I'm gonna have you
Fuchs.
step away, actually. So, I have my little light field. I always put my marker to the side of the little box that's in the center of your guys' plate. That helps me reference where my marker will not be in the way of the odontoid. So I always stick my marker right there, and then I'll bring my patient in front of it, okay? Because I know this way, the odontoid isn't a very big bone, so you would get it in that little square. I know it looks really tiny, but you also have to think about beam divergence and everything. So that's why it looks a little bit bigger, but as long as your marker's just the outside of this little box, it'll show up in your picture and not get in the way of your anatomy. You're gonna put your back against the board right here. Okay. Now you can open your mouth as and you're gonna be centering right in the center of their mouth. I'm gonna erase that right, Mike. The other thing is you're gonna wanna raise their head so that the base of the skull is in line with their jaw. So you're gonna open as wide as you can, and then I'm gonna have you tilt your head back just a little bit. Yeah, right there. And then you also wanna make sure that your patient isn't turning their head side to side, okay? One thing I'll tell patients is imagine you're eating a Big Mac, so then they,
Oh, in
tend to.
that case.
Yeah.
You're holding back on me.
Like another dentist.
Yeah, you can relax. But that's exactly why. See how big patients open their mouth when you tell them they're going to be eating a big burger? And so that's how you would do the odontoid. You do have to be really careful with the base of the skull for this one, because if it's pulled back too much, then it's going to obstruct your dens and the zygopophyseal joints. Okay?
And this one we're looking. This shows C4. Or is it shows C?
No, it's C1 and 2.
Oh, okay, that's right. Because it's up here.
And the reason why we have this particular view
Yeah.
for it is because the skull obstructs it on all
Yeah.
the other pictures.
Mm-hmm.
So that's why we do it this way. I have seen the dens fractured in somebody before, so it is important that we get that picture in there.
And where do you center again?
Just in the center of the mouth. Yeah.
How would you instruct your patients to open their mouth? Because I've seen patients do overkill, like use their facial muscles and like open it like wide. Should you just tell them to drop their jaw?
No, it's better that they open wider than not enough.
Okay.
So I always have them open wide, but if they like really reach back and throw their head back, then all I do is I let them keep their mouth open wide. I just turn their head forward and bring their head down a little bit, and then you'll get a good picture.
Okay, but sometimes they go like that.
Yeah.
So,
Oh, I see.
like they use
I
their
would
facial
say
muscles.
instead of I would just say you need it wider instead of narrow,
Yeah.
because some people do that. But that's why I use the Big Mac analogy, because then they go, oh, it needs to go in my mouth.
Yeah, it needs to be wide. Yeah.
Yeah, we don't need a do re mi fa sol. We don't need someone singing. We need them to eat a burger.
And then again, you're raising the chin to superimpose with the base. No?
Not the chin. So one way you guys can make sure that the base of the skull isn't going to be in the way, or that their front teeth aren't going to be in the way, is if the base of the skull and the bottom of the jaw are lined up, so they raise just enough, and then there's a line that you can imagine going through the two. Yeah, and then you guys can like practice on each other to see where that would be. Because remember, when someone opens their mouth too, it kind of morphs their head. You can't feel it with their mouth closed. Their mouth needs to be open, and then you'll see what I'm talking about. Okay. All right. You guys have any questions? Oh yeah, I need to show you guys the cross table lateral. Okay, so I don't know whose paper that is. Mike, if you don't
That's
mind
mine.
laying down. And then